Hi there. I've got a question about the estrogen patch. Is that an adequate patch?
Yeah, so the bioidentical estradiol patches on the market are adequate, yes. They're better than nothing. They do not allow you to vary the dose. And sometimes with the transdermal creams, we do change the dose. So with the patches, you put the patch on a couple of times in a week or whatever your schedule is. They do deliver the medication effectively. And so if you have your serum levels checked, you will find that you're getting adequate absorption. Just make sure that they are the bioidentical estradiol. I think the newer ones all are. But yes, they will do the job. The only thing is it's not with progesterone or testosterone. So all you're getting is just the estrogen. Okay? So just as long as you know that.
Is that appropriate without the progesterone?
And that's a very good question. And in our eyes, the answer to that is simply no, it's not, simply because progesterone provides many benefits. And if you have your uterus, then you definitely need it. What they say is that if you don't have your uterus, you don't need progesterone. I feel that you still need it because progesterone is a GABA mimetic. It crosses the blood-brain barrier. It helps improve sleep quality. It reduces anxiety. And so we do like to use it. I use it personally as well, and I find it very helpful. So there are other indications for progesterone use as well, but balancing the two hormones is very important. And then let's not forget about testosterone. And again, women sometimes get alarmed when they hear about testosterone. And then some women that are aware know of its benefits. The doses are completely different in men and women, but men and women have the same hormones. The amounts are very different, but they have the receptors for the hormones in their body. And then those hormones are brain hormones and they perform function. Testosterone helps you build muscle mass. It helps maintain bone health. It is important for your self-confidence and for your feeling of well-being. And when it is adequately balanced with your testosterone and your progesterone levels, you just feel differently. It just gives you that feeling like I'll be okay. And then you see the results when you work out. Remember, you're losing muscle as you're getting older. Our goal is to help you maintain your muscle so you have endurance, you have stamina, you can stand, you can hold, you can stand up yourself. And we want that for you, and we don't want you to lose that muscle. And in order for that to be successful, protein alone in your diet is not going to do it. You need the hormone to help you succeed, especially if you are good with your exercise program. You want to see the results. So we do the in-body, we look at what's happening to muscle, we show you where you're at, and we look for results. And I always look for where's your testosterone, what happened to muscle mass, every single visit without fail. Okay?
So the patch doesn't give you enough of the testosterone then?
It does not. So testosterone is higher up in the cascade of hormones. Testosterone breaks down into estrogen, but the opposite does not happen. And so, yeah, it does not give you the other hormones. So sometimes, what we think about is, women and estrogen, and we equate the two and we go, okay, if we give a woman adequate amount of estrogen, we will cover our bases and she should be fine. And that is an incomplete answer. It's wrong because she needs other things, and then, it's better than doing nothing. I'll say that. But it's incomplete, especially if she has her uterus, then you really have to be very careful. And then there are other symptoms she has which are not being addressed with just estrogen alone, okay? But yeah, we know very clearly that they do help. Estrogen helps reduce your risk for cognitive decline. It helps with verbal fluency. If given at the right time in menopause, it'll help reduce your risk for developing breast cancer. It helps reduce risk for colorectal cancer. It helps with heart health. It helps reduce risk for osteopenia and osteoporosis, so bone health. It helps with skin, hair, eyes, and vision health. So there are lots and lots of advantages of using estrogen alone. It's incomplete, though, however, to use it just by itself without paying attention to everything else that it affects in that hormone. It does not exist in isolation. It comes from other hormones. It breaks down into other hormones. So if you address the whole physiology, then you don't cause problems. Too much estrogen can cause breast tenderness. It can cause sleep impairment. It can cause problems in the uterus if you have your uterus. So if you balance it with progesterone, you avoid the side effects and you help with the benefits. So it balances in normal physiology too. Women balance their hormones cyclically normally. So what we're trying to do in postmenopause is give not the cycle, but try to give enough of the other hormones as well so that they have the advantage of the other hormones. Every woman has testosterone in her body. It is there for a purpose. It does decrease when you get older. It's already lower than a man, but it's decreasing. But as it is decreasing, that function is going away. She's becoming weaker. She's more frail. Her bones are weaker, and her self-confidence is gone, and she's not able or capable of building muscle. So if she needs to do that to live, then yes, she absolutely needs that. We have to avoid sarcopenia. We have to avoid frailty in our women, and you need the balance of these hormones to do that.